Hi, everyone. Welcome back to Office Hours with Dr. Ellen Derrick. I'm double board certified in general and vascular surgery, also board certified in obesity medicine. Today, we're going to talk about my journey to becoming a triple board certified surgeon in general vascular and obesity. So, I was really lucky, and I had two wonderful grandfathers, and they were both surgeons, and they were surgeons at a very special time in America. And they're both from Houston and helped build the Texas Medical Center into what it is today. And I grew up at the dinner table, listening to all their wonderful stories of taking care of patients. And I read love letters that one of my grandfathers wrote to my grandmother when he was doing his residency in the Smoky Mountains of Tennessee. And he had to ride a donkey in those days to see his patients. And he wrote about delivering a premature child and having to build sort of a makeshift incubator and how much that meant to him as a young man and a young physician. I always thought that helping another person was, one of the highest callings that there could be. And I was 8 years old when my grandmother asked me what I wanted to do when I grow up. And I said, well, I want to be a doctor like granddaddy. And she said, that was a great idea. That's important because she was born in 1908 at a time when women were not educated routinely. I remember at her bridge table when I told her I wanted to be a surgeon, she did not say to me, but you're a woman. You should be a wife and mother. She said, that is a great idea, Ellen. You'll be a terrific physician. And I'm very lucky that I had grandparents and parents who believed in me and believed in my dream. Ooh, what made me choose surgery? Okay, so they're all surgeons in my family, just everyone. And so I probably grew up in an environment where surgery stories were told and the fun of surgery, the joy of surgery was routinely discussed. My grandfathers were really big figures in early Texas surgery. And I went into medical school and I thought, well, they've already, changed the world with surgery, so I'm not going to do surgery. I'm going to do internal medicine and psychiatry. I'm going to learn everything about the human body and I will contribute differently to medicine. They've already done the contribution for surgery. I went through my third year rotations and I remember coming home on spring break to see my parents and I was cried the whole way home because I knew after doing all my rotations that surgery was really the only thing I loved. It was the only thing that made the sacrifices that I had to do to get into medical school worth it. And I remember I came out of the car and my parents, they, walked out to meet me and help me with my bags. And I said, with such a heavy heart, Dad, Mom, I've given this a lot of thought and I cannot be an internal medicine doctor or a psychiatrist. I have to be a surgeon. And there's just no other way. And my dad gave me a big hug and said, well, honey, your mom and I, we already knew that. We were just waiting for you to figure it out. Okay, so why vascular? Because it's hard. There's all those cheesy posts like do hard things and I love hard and I'm doing hard. I love vascular surgery, guys. It is hard. It pushes you to think. It pushes you to be technically excellent. It pushes you to have a great bedside manner because your patients are frequently dying or losing a leg or going on dialysis. It is so hard. I think I just enjoy being driven. It's very inspiring every day to get up and have to give your all. Like that is so, it's awesome. I'm so thankful. So, vascular surgery, nothing is like vascular surgery, in spite of what neurosurgeons may say. There's a lot of details, guys. It's arts and crafts. Vascular surgery is a lot of arts and crafts. If we're doing a bypass, we don't take the bypass out of a package and just plug it in. We have to explore your artery. We have to look at your artery, feel your artery. We have to look at your artery on ultrasound, look at your artery on angiogram. Then we have to look at your leg. We have to think about how your leg moves. Then we have to think about how big your blood vessel is. Then we pick something called a conduit, and it's a tube or it's a vein. Then we have to harvest the vein or cut the conduit. We have to fashion the hood so it looks like a cobra. We have to tunnel it with a tunneling device. You would not believe what that looks like. It does look really dramatic. We have to do that safely. Then we have to hook up the top and hook up the bottom and make sure that it flows. We have to move your leg to make sure it's going to keep flowing. And it also, at the end of the day, when you ask yourself, did I do a good enough job on the bypass today? So I can hear your pulse in your foot. That will give me a lot of information. But there's also something that we always say, if it looks good, it is good. And you'll know it when you see it. And so the last look that you do is you look at all of your tiny, tiny stitches that you had to use a microscope to make that was sutured the size of a hair. And it's blue usually, the suture, so you can see it. But you have to look at all of your tiny sutures and decide if it looks good. And if it looks good, it is good, and you're ready to close. Endurance. Being a great vascular surgeon and becoming a vascular surgeon is similar to probably any type of surgery. The individual has to develop the skill of dealing with being overwhelmed and outside of their comfort zone on a daily basis. The other thing that makes a great vascular surgeon is a combination of perseverance and humility. And let me explain. Anytime you operate on any part of the body, there is an element of humility because you're not the boss of the body. You're not the boss of the disease. You're not the boss of the outcome for the patient. You can be the engineer and you can set up the patient to have the best outcome possible, but you're not the boss. And so great surgeons always have to show humility in the face of the disease that they operate on. The additional factor that's different for vascular surgery, and I'll compare it, for example, to colon surgery. If a patient has colon cancer and requires a resection for colon cancer, the surgeon performs the surgery successfully. They remove the colon and it's over. They are not going to go back and remove that same piece of colon again. They've completed the surgery. The patient's cancer is cured, hopefully. If it's not cured, it's a huge step towards treating with adjuvant therapy. When a surgeon operates on a blood vessel, you are operating on the piece of anatomy that continues to advance from a disease perspective. So you can do a bypass for a leg or put in a stent. In a certain period of time later, you will be back in the leg, ballooning the stent or doing a new bypass. You know, it's almost a losing battle when you operate. Folks that do vascular have to love homework and they have to be comfortable showing up every day in the face of failure, not because they did a poor job, but because the disease is not curable. And the patient is the one that has to live with it. And the surgeon is the one that has to show up and give their best every day, knowing the disease isn't curable. There are a lot of things that went into me opening VoxBar. I learned a lot about being on a team in vascular surgery in Seattle when I graduated from my fellowship training. I had the opportunity to work on some great teams with some great surgeons. That was a lot of fun. And then there was a time where I wanted to step away from team surgery and create an environment where I was the solo operator. And there are a lot of pros and definitely some cons for being a solo operator in my own practice. But I was 40 and it was just the right time for me in my life and my career to transition to solo practice. Being in solo practice gives me a lot of freedom to build an environment that serves patients the way that I want to serve patients. It also gives me freedom to develop a work culture that I feel safe working in, that promotes other women and men to be successful and to grow. They can be interviewed later and talk to you about what it's really like behind the scenes, but that was a very big motivator for me, was to build an environment where folks could become the best version of themselves. And I think lastly, having solo practice allowed me control over my schedule so that I could have breakfast with my children and take them to school, and I could be home in time for dinner because my practice is about a mile from my house. At 40, that piece of life just became very important to me. And I took a page out of my great grandmother's rule book and put on my big girl underpants and decided to be brave and open the first box bar practice when I was 40. Thank you guys for joining me today on the episode Office Hours with Dr. Ellen Derrick about why I became a vascular surgeon. And I hope this episode is valuable for you and gives you encouragement, gives you hope, and gives you a lot of joy as you chase your dreams.